Hello?
Hi, it's Dr. Patel from Fort Worth Fertility. Is this Savoya?
Hi, doctor. Yes, this is she.
The Northern Dallas that does it.
Yes.
MTIDR.
Yes, that's the same doctor. He worked on my mother. So I called them and asked him about the procedure, and he said that they were able to perform it. I was like, I wanted to ask you, it's because I know my cycle is about to start, right? And the procedure is going to be done December 8th. Do you think it's possible for us to do an IUI immediately afterwards? Because my tubes will be back open and...
Yes, of course.
Yeah.
Yeah, what I would do is just like you'd be still. It really depends. The meds work the best, Savoya, if you start them before day 5.
Right. So right now, the reason why I called you and I made it so urgent, I wanted to talk to you urgently, is because today it's like really, really light pink, and by tomorrow it's gonna start. That's why I figured if you can put me on the enhancements now, I have the procedure done on the 8th, and then I'll come in and do the IUI on day 14. Or, you know what I mean?
Yeah, you can totally do that.
Awesome.
Can you come in Monday?
On Monday when?
Oh, what time is good for you? I can put you on the schedule.
Oh, okay, so I have to come in Monday to do what though?
The sonogram, and then we put you on the meds.
Oh.
And then you'll do another sonogram. Actually, your date is on Tuesday, right?
Yeah, but it's not this week. It's gonna be on December 8th. So come in.
I know.
So come in that Monday, December 7th.
1 second, sorry. So 1, 2, 3, 4, 5. What I would do is I would have you seen Monday by us, December 30th. I'll do an ultrasound. We'll start you on the meds, and then you take the meds all week. And then on Tuesday you have that procedure done. And then after that procedure, you can actually come in here on Monday the 7th. And then on the 8th you'll have that procedure done, and then the IUI will probably be on the 9th or 10th.
Okay, so do you think do I have to have the sonogram done, being that, because they're going to do a sonogram there too? I mean, could we...
We don't get fertility meds without doing monitoring ultrasounds.
Oh, okay, I get you. Because I was thinking Monday my flow is going to be too heavy. That's why...
You can come in Tuesday.
Okay, well, let's try it that way then.
You want to come in Tuesday?
I mean, we could do it Monday. We could do it Monday or Tuesday. I know if tomorrow is day 1, 2, 3, 4, 5, Monday will be day 5, right? And I was thinking I was gonna start the fertility meds like on day 3 or 4, or day 3 or something.
If that's the case, you can also come in Friday.
Ooh, honey, that's gonna be day 2. It's gonna be a massacre. No.
Yeah, it's gonna be a massacre. That's why I said Monday originally, day 5, so things are quieted down. But you don't gotta worry about the bleeding, Savoya. I mean, I'm a gynecologist. We see you bleeding all the time.
Yeah, but okay, doc. So, okay, Monday, I'll work Monday. Oh Lord, Friday. Well, let's do Friday. I mean, you do this all the time, and let's do it Friday, because the sooner the better, because I think last time we did it, I felt like it was a little bit too late, and I ovulated and all that, so I would rather start the medication as soon as possible. I wish I had spoke to you sooner, because I could have came in and did it today. You understand what I'm saying?
Yeah. Well, you know what you can do, Savoya, is I can give you birth control pills to take, and you take them for 2 weeks until you have that procedure done, and then you stop them, and then you're going to start bleeding and you'll have your cycle.
Oh, but I was wanting to do the IUI, doc, right after the procedure to increase, because my tubes will be freshly opened.
Right. So the best day to come in then would be Monday.
Okay.
Because then the IUI will be on the 9th or 10th. That's why I said Monday initially.
Okay. Well, let's do that then. Let's do that.
What time is good for you? I can put you on anywhere.
Monday at 10:30, I guess. Oh, Monday I work. Okay, Monday at 10:30. I'm just gonna have to go to work late.
Okay, you can come earlier if you want.
No, because of traffic, and I'm coming away from the seat,
Yeah.
Yeah.
All right, perfect. I got you Monday at 10:30.
All right, awesome. Thank you.
You have a Merry Thanksgiving, okay?
You too. Thank you so much.
Bye.
All right. Damn, he have to do a sonogram first. Ugh, sonograms are expensive too. Damn, they hit you up every time. Okay, well, that's a plus. So I'm excited, you guys. I'm going to have my procedure done where they're going to go in and use this catheter to open back up my tubes. You know, they were closed. And right after that, a day or two after that procedure, we're going to go ahead and do the IUI to increase our chances of conception. I'm just disappointed he can't start me now. But okay, you guys, I just want to I'm going to give you guys a brief update on what the doctor and I was talking about. As you all know, I have been trying to conceive, and I had a tubal reversal done some years back, and I had fibroids removed last month. And during the procedure, the doctor noticed that my tubes were back closed. Now, y'all know that was heartbreaking. So he told me to come back after, 1 month to see if, to do another HSG test to see if my tubes were open. Sometimes due to all of the extra tissue from the procedure or the surgery I had, the fibroid removal surgery, that maybe they clogged up from that or something. So we went back in, did an HSG test on last week, and guess what, y'all? It confirmed that my tubes were indeed really, really closed. So that hurt my feelings. But anyway, y'all, luckily, after that, and the doctor came to me, he consoled me, he hugged me, he apologized, and he was like, well, maybe the next phase is IVF. But little did he know, I did some research, and I even told him about it, and I was like, well, there's a procedure, and I know some gynecologists, they do this procedure, but he didn't do them. I was telling him about this procedure that I know they do with the HSG. It's the same procedure, just like an HSG, but it's where they go in. I don't know the name of it, but they go in just like they're doing an HSG, but they go in with a longer catheter, and in the catheter there's another wire that they put through the catheter, and they thread through your tubes, right, and try to brush out that scar tissue or whatever was causing the blockage in your tubes. So he told me that we should just try IVF, but I'm very hopeful, and I feel like I should give it another shot with opening back up my tubes, just to see if, if I open them back up and then I do a couple of rounds of IUI, immediately afterwards. So that's the reason why I called him, because I have my procedure next week on December 8th, and I know my cycle is about to start. So if he was going to go ahead and do the enhancement of medication, he can go ahead and start me on those as well. So as soon as I get done with my procedure, we can go ahead and do the IUI backdoor and just do it real quick to increase my chances of conception. And the reason why I don't want to go the IVF route just yet, I know I'm getting old, I'm 43 now, but I have been pretty lucky enough to have healthy eggs, because we did like this test, AMH, and all those extra tests they do to see the quality of your eggs and your egg reserve, and I still produce a lot of eggs. I remember one time he put me on the medication, I had like 19 eggs altogether, and then the very last procedure, well, he gave me, I had 19 eggs, but I only had 2 mature follicles. But the last time he did my enhancement, I had like 5 mature follicles on one side, 4 mature follicles on the other side. But the only reason why I think I didn't conceive, you guys, is because my tubes were blocked and I had no idea. Because I had did an HSG test like a year or 2 ago, but I don't know during that time, if they were open or closed, because I didn't have another test in between. So that's the only reason why I think I didn't conceive. But y'all, I'm very hopeful, and I hope that this time with this procedure, with us doing the IUI immediately after the opening of my tubes, that I'll get pregnant. So that's one of the reasons why I have decided to go ahead and give it another shot, y'all. With me having healthy egg reserve, me producing all them eggs at my age, I just feel like I should just try a couple of more rounds of IUI before I go into IVF. So for any of you females that have been told your tubes are blocked, and oh wait a minute, I forget to tell y'all about the whole T regimen thing, and then the serapeptase. I don't know if I should have given it more time, but of course I did the serapeptase. I didn't go to get the HSG test done right away. I waited like 4 weeks. you know. And when I read the instructions on how to take it, it's like you take it, don't take it on your cycle. But then I'm thinking, if I don't take it on my cycle, if I take it the week before my ovulation, that's only giving me what, about 6 or 7 days to take the tea. But don't take it while I'm ovulating, but don't take it in your 2-week wait. I'm like, okay, so if I go based off these instructions, hell, when am I going to be able to take the medication to get, you know, to help my scar tissue? So I've decided, like I told my husband, it's either we do the regimen for 2 months consecutively without trying to conceive. That way I know I can get the full, you know. But anyway, y'all, I just think that, like I told my husband, either we don't conceive. I mean, either we don't try to conceive within these next 2 months and stay on the regimen of taking the Chinese tea, and then, you know, trying to open up my tubes, because that stuff's supposed to flush you out, or that serrapeptase, because it's supposed to be for scar tissue. But if I do it based off of what these women are saying or how they telling me how to do it, then when is the stuff gonna work? Like, when do you use it to make it work? Because that means that you're only allowed to use it within 1 week of your cycle. You know, 1 week. I'm like, that ain't gonna work unless I just go full force 2 or 3 months without trying to conceive and take those teas and that serrapeptase. So I decided to just do it the fast way. Y'all know me, I have a surgery. If I can fix it, cut it, get it done, and be done with it. So I've decided to go ahead and call me a vascular doctor, which they open veins and stuff. And this same doctor worked on my mom, because she had like some sort of clot, blood clot going on in her veins in her legs, and he opened them back up, and then it'll allow her blood to flow back normally in her legs. But at any rate, the same doctor, the vascular doctor, that's the same doctor, they open back up your tubes. So for any of you females that have been told your tubes are blocked for whatever reason, trust me, a vascular surgeon can go in and he can use, instead of just going the IVF route, try going, it's not called a HSG, and I forget what the procedure is called, you guys, but it's when they go in, like they're going to do a HSG, and they use a catheter, and they use this wire that goes in, and it open up your tubes going back and forth. Okay, so just try that first, y'all, before y'all spend all that money on the IVF, honey, because the IVF alone is $16,000. That's not even including all the enhancement drugs you have to take up into, you know, the transfer, egg transfer, and it's just a lot. So I have decided to give myself a couple more rounds. I think I still got it in me. You know, I know I've been reading other miracle stories on women my age, or even 44, 45, that have actually conceived naturally. So I want to go that route first, at least do a few more rounds of IUI before I just give up hope and go straight to IVF, honey, because that's gonna be, I don't know, I already spent some thousands. Y'all know that's gonna cost even more. So I'm just gonna be hopeful. But at any rate, I just wanted to give you guys an update on that. So next week is my procedure, and I'm gonna keep you guys updated on how well that went. All right, see you soon. Thank you for watching. Y'all always forget to say that. All right, bye.